It's nice to know that there's a great pediatric dentist here in town. Dr. Doug, this is a fantastic facility that you have here. Great staff. I'm enjoying this visit so much and getting to know you. I never knew you could bring a baby in for dentistry.
Well, that's right. I mean, my youngest patient ever was 2 days old, born with teeth, and mom brought her in, and we're able to take care of her, and and we see kids up to 16, and then individuals with special needs we see at any age. So
I love that you're here and that your focus is that kids and kids with special needs, and even adults with that same need, that you are here to service them. You have a special way about you that makes that ability happen, right? Not everybody can work with kids.
Well, I think that you have to have a kind of the nature about you to work with children, and so we just want to have fun, and we want to make things really enjoyable for the kids. I love working with the kids. It just makes my day really enjoyable. Anything that can happen will happen with kids, that, and so it's awesome.
Well, the staff has said that while we've been here today, and they're just laughing, and everybody's having a great time. But beyond the fun time, there is a need there. Now, I have heard about babies being born with teeth, but other than that, what would I be looking for or needing to bring my child in?
Well, I mean, as a parent, what we really want to do is educate parents and make sure that they're doing things that will make a healthier environment for their children's mouths and teeth and developing teeth. And so, some of the things we go through is about diet and doing a thorough exam, making sure things are developing the way they should, because a lot of times, we'll see some anomalies or some things that are a little different, and then we can take the right action to correct those at an early age, so things will develop correctly. So. Well,
and I have heard, and you can tell me if this is true or not, that mouth health is part of overall health?
Sure. It's all, the knee bone's connected to the thigh bone kind of thing, it's all connected. And so, if your oral health is a little bit better, or it's well, then you're going to have an overall better health. So
start young. Start young and make sure. Now, you've got a great assistant. Tell me your official title.
I'm the head dental assistant.
Which means you get to clean all these cute kids' teeth and actually side by side with Dr. Doug?
Absolutely. We're a good team here.
You are a good team. In fact, the whole staff, it takes a good team, doesn't it, to make it work in a dental office?
Wonderful staff. We have great staff. So.
And he calls you A1, number one, right?
I've been here the longest, and I've helped train most of the girls. They're very specific on what they want us to do. We want to be very specific with kids. So.
Well, and don't you find that true with children? It does take a different bit of training in that.
It absolutely does. With grown-ups, they can handle the nervous things, but as a child, you kind of have anxieties about things, getting away from mom, kind of talking with strangers, yeah.
Exactly.
Yeah, exactly. Okay, so Lacey, as the patient comes in, you'll bring them back into any one of these fun rooms.
Absolutely.
And then start with the cleaning process. You've got TVs to choose from.
Yeah, we get them all relaxed. They get to watch a movie. We kind of talk to them. We get to know them. See, with checking them, we also want to get to know them and see how they react to certain things. If they can do the hard stuff, then we know that with treatment, we can kind of do mainstream treatment. But
okay, well, I know Patricia is the child's companion, and she gets to play with them out front, brings them back to, passes them off to you, I suppose, and gets to play again. And then Dr. Doug comes in and finishes up with the final exam.
Well, that's right. And, when we do our exams, one of the things that we don't do is just open the door and say, next. Yeah. Lacey comes out, and she will actually interact with the child and make sure that they're comfortable with her, and then she'll have them come back, and like she was saying, she'll see what they'll do. If they want to just do a knee exam and be close to mom or dad and just be real close while we do our exam, that's great. But if they're a little bit more daring, then we'll kind of take advantage of their daringness, and we'll get them on the chair, and we'll let them watch a movie like Lacey was saying, and and just go from there. And that also helps us, like Lacey was saying as well, that it kind of is an indicator of if there are some issues that we need to take care of, how we might be need to take care of them.
This is a whole neat, unique concept in child care and dentistry. And Dr. Doug, you nailed it. This is fantastic, from the facility to your staff.
Well, thank you. And, that's just one of the things that we do as pediatric dental offices, that we make sure that we're very well equipped and very prepared to help your child and make sure that they're well taken care of.
Tell everybody how to get a hold of you and be part of this team.
It's 435-792-3033.
And the location is?
The location is 1300 North, 200 East in Logan, just directly behind the Cache Valley Mall.
So easy to find. Dr. Doug, your pediatric specialist. Thanks so much.
Ba-dum, 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 ba-dum.